So moving on to a new cardiac disorder, that is inflammatory disorders of the heart. Okay. Now inflammatory disorders of the heart are nothing but some of the major infections that are related to the heart. Okay. So before starting with the inflammatory disorders of the heart, we will see what are the layers of the heart. Okay, so we have got mainly three layers. We are already aware about it. There are three layers of the heart, and it includes your outermost layer, that is your epicardium, then the middle layer, which is a myocardium, and the inner layer, which is a endocardium. Okay, so all these three layers of the heart can be inflamed and infected. Okay, so that is referred as the inflammatory conditions of the heart. Okay, so we will study regarding endocarditis, myocarditis, as well as pericarditis. Okay, so pericarditis is nothing but the outermost layer itself. Okay, and now in detail we will see regarding the topic endocarditis. Okay, so endocarditis is also an important topic. Now this endocarditis is sometimes referred as infective endocarditis or bacterial endocarditis. Now why the name infective endocarditis is come, it is because most of the time what happens is there can be infection or in the endocardium because of the microorganisms. Most of the time microorganisms like the bacteria are responsible for endocarditis. That is why the name has come as infective endocarditis. And one more name is bacterial endocarditis. The name has come because most of the time it is caused by the bacteria. Okay, so we will discuss regarding all this in the etiology. Okay, that we will come to the etiology and we'll discuss. So moving on to the definition of endocarditis. Now, endocarditis is nothing but the inflammation of the inner layer of the heart. Okay, so we already know what is endo. Okay, we can divide this term endo and carditis. We already know what is itis. Itis refers to the inflammation. Okay, so itis refers to the inflammation, and card refers to the heart, while endo it refers to the inner layer of the heart. So remember, endocarditis means it is a inflammation as well as the infection of the inner layer of the heart. So that is the definition of endocarditis. Now if we are further going to define it in a better way, we can tell that this endocarditis is the infection and the inflammation of the endocardium. Okay, and most of the time when there is infection in the endocardium, what happens is the infection can also spread to the valves of the heart. We already know there are different valves, isn't it? For example, we have got AV valves, semilunar valves, isn't it? So these valves also will be affected along with that, and mainly this endocarditis is because of the microorganisms, commonly because of bacteria, and sometimes even because of the fungal invasion. So that is the definition there. Infection of the endocardium and heart valve. Okay, we also refer the heart valve as cardiac prosthesis. Okay, like what happens is cardiac prosthesis means artificial valve. When the normal heart valve is not functioning, what they will do is they will replace it with the artificial valve. You will study about it in detail in the coming units. Okay, so when the artificial valves are used in the heart, okay, in that case also most of the time infection can happen, so that will result in endocarditis also. Okay, so that is why this definition. Okay, otherwise the most simplest definition which you can write is it is the infection and inflammation of the endocardium, which is the innermost layer of the heart. Okay, so this is just a picture of the endocarditis where there is a inflammation of the endocardium. Now, moving on to the types, most of the time we have got different types of endocarditis. The most common type of endocarditis that we see is subacute and acute bacterial endocarditis. Okay, we'll see in detail regarding each one of it. So the classification is subacute bacterial endocarditis, acute bacterial endocarditis, native valve endocarditis, which is also called prosthetic valve endocarditis, and non-bacterial thrombotic endocarditis. Now, first of all, moving on to the subacute bacterial endocarditis. Now, the subacute bacterial endocarditis is nothing but it is gradual in onset. Okay, gradual means it is slow. It will develop or it will take weeks or months to develop. Okay, that is it's slow in onset, and the name itself suggests there it is caused by the bacteria, and most commonly it is caused by the streptococcus. Next one is acute bacterial endocarditis. Now, acute, acute means it is sudden in onset, isn't it? It develops suddenly, and most of the time, this acute bacterial endocarditis it develops within days or even within weeks. And that is why what happens is because it is sudden in onset, it will result in complications most of the time. And this acute bacterial endocarditis is also caused by the bacteria, and commonly it is caused by Staphylococcus aureus. The next one which I told was native valve endocarditis. What was the other name? The other name is prosthetic valve endocarditis. Already I told you the meaning of prosthetic. Prosthetic means it is artificial. Okay, so artificial valve. So whenever you are using an artificial valve, there can be chances of infection. Okay, so there can be infection in the normal valve also, or sometimes even in this artificial valve also can be damaged. Okay, so that time we refer it as native valve endocarditis. Next one is non-bacterial endocarditis. Okay, now the non-bacterial endocarditis, which is also called as non-bacterial thrombotic endocarditis, here what happens is it is not mainly because of the infection. Okay, non-bacterial, it is not mainly because of infection, or it is also not because of the bacteria, but it can be because of some thrombotic lesions. Okay, in pathophysiology I will tell in detail how this thrombus is formed. Okay, so here non-bacterial endocarditis means it is not occurring because of the bacteria, but because of some other reason, that is because of the thrombus formation or the clot formation. Here in the figure you can see some vegetation, some lesions are there, that is actually of non-bacterial endocarditis. Now moving on to the causes of endocarditis, as I told, most commonly endocarditis occurs is because of the infection by the microorganisms. Commonly bacteria is responsible, that is like your staphylococcus, streptococci, E. coli, Klebsiella, Haemophilus, Pseudomonas, all these bacteria can result in endocarditis. Other than that, fungi are also responsible for endocarditis, and very few viruses also result in endocarditis. So that is the main reason. Okay, other than that there are some risk factors or predisposing factors. Okay, this is very very important. Now what are some other risk factors for development of endocarditis? It can be because of cardiac problems, or it can be because of non-cardiac problems also. Okay, remember that. So first I will tell, because of the cardiac problems it may result in endocarditis. What are those cardiac problems I will discuss? So probably if a person was having prior endocarditis, that is before there is a family history or history of endocarditis, in that case that can become like a risk factor. Other than that, people who are having artificial heart valve, who are using artificial heart valves or prosthetic heart valve, they are at risk of developing what? Endocarditis. Okay, or if at all a person is having acquired valve disorder. Acquired valve disorder is a one type of valve disease which you develop afterwards, after your birth. Okay, because of some other reasons you will develop the valve disorders. Okay, so that also can predispose you to endocarditis. Next is if a person is having any lesions on the heart, or if they are suffering with the RHD and RF, that we will discuss in the next coming classes. Okay, so RHD is a disease condition which is referred as rheumatic heart disease, and RF means rheumatic fever. Or otherwise, sometimes when a child is born only, they may have some congenital heart problems. So in such children, there is a risk of developing endocarditis. Or if a person is using pacemaker, these type of patients are also at risk of developing endocarditis. Or if they have got any problem with the heart muscle, there is decreased functioning in the heart muscle, that time, that is when there is cardiomyopathy, those patients are also at risk of developing endocarditis. Okay, so I told that there some patients may use artificial valve, isn't it? So we have got different type of artificial valves, like your mechanical valve and tissue wall. So this is just a picture of it. Okay, and this shows the infection or the growth that we call as vegetation, which grows no on the endocardium. Okay, that we will see again in pathophysiology. Now, what are the non-cardiac causes which will predispose a person for endocarditis? Non-cardiac causes includes a person who is having IV drug abuse. So what happens is when they are having this multiple IV injections are used or drug abuse is used, there can be infection, isn't it? Microorganisms can enter inside through the bloodstream. Okay, that can be one cause for endocarditis. One more is different procedures are performed, isn't it? We have got so many procedures or surgeries which are done, like your genitourinary surgery, GI surgeries are there, neurology, musculoskeletal, isn't it? So many surgeries are there. If at all it is not done in an aseptic technique, what will happen? Most of the time there can be traveling of this infection into the heart. Okay, it can infection can travel through the blood, and that may result in endocarditis. Okay, so this is a non-cardiac cause for endocarditis. Remember that. Okay, not only surgeries, entire body, any type of surgery, GI, respiratory, neurology, all the surgeries, there can be risk of endocarditis. So that is why you might have seen that before the surgeries itself they will start with the antibiotics, and after the surgeries also they will continue the antibiotics. The reason is mainly to prevent the occurrence of the infections. Okay, other than that we have also got some minor procedures like your dental procedures, maybe your tooth filling or RCT, that is root canal treatment, or just your cleaning of the teeth. These procedures also, what happens is when the microorganism enters through the bloodstream and multiply, that can affect your endocardium. Okay, so if a person is having any tooth abscess, there is pus in the tooth, or they have performed any oral irrigation, or they have done a minor procedure like tonsillectomy where they are removing the tonsils, okay, that time also there is what chances of endocarditis. Okay, because of the infection. Next is respiratory procedures. Now we know different respiratory procedures like biopsy can be done, bronchoscopy can be done, then GI procedures like endoscopy, colonoscopy, or major abdominal surgeries and all. During this time also, when the surgery is not done in an aseptic technique or when there is bacterial invasion and multiplication, it can result in endocarditis. Other than GI procedures, as I told, genitourinary procedures or even surgeries like your minor procedures like cystoscopy, where you are observing the urinary bladder, or prostate surgery, during that time also we can be at risk of developing endocarditis. And other main predisposing causes, if a person is having any open wound, what will happen when there is open wound? Bacteria may enter through the blood, and that may cause infection and it may affect the endocardium. Next is when you are using these injections, especially infected ones like IV cannulas and all are used, that also can predispose for endocarditis. Or if you have got any upper respiratory tract infections like your rhinitis, sinusitis, otitis media, if it migrates or spreads to the endocardium, that may cause endocarditis. Or when a person is intubated, we know that when a person is put on a ventilator, commonly we will intubate the person, isn't it? So that time also a person can be at risk. Or if the person is using any IV catheters, that time also they can be at risk because bacteria can enter the bloodstream and it can also affect your heart. Next is some other procedures like your hemodialysis, isn't it? Now, hemodialysis procedure is commonly done continuously, isn't it? So, during this time also what happens is the bacteria can enter and it can multiply and can predispose for endocarditis. Next is reproductive surgeries like your maybe conducting abortions or even conducting the deliveries, or if there is any history of pelvic inflammatory disease. Okay, in all these cases what happens is it may predispose a person for endocarditis. Next is moving on to the pathophysiology of infective endocarditis or bacterial endocarditis. Okay, so the normal thing that happens is main three things you should remember is first is the microorganisms are entering to the bloodstream, they will multiply and they will result something that is called as vegetation. Okay, I'll tell you in detail now what happens it, but these are the basic terms which you should not forget in the pathophysiology. Okay, so due to etiological factors, that is your mainly open wounds are there, or a person's immunity is very low, especially your immunocompromised patients. Okay, or if a person is having any artificial valve, or they have undergone any recent minor procedures or major surgeries. Okay, so because of these etiological factors, what will happen? The bacteria can enter. Once a bacteria enters, what happens through the blood? This bacteria will multiply. Okay, they will multiply, and they may also enter into the heart, and they may affect your heart valve or heart walls, leaflets and all. So when they are affecting the heart, what happens is, along with that, it may not only affect your valve, but also it will affect your endothelium. Okay, it may affect your endothelium. And whenever there is endothelial damage, what will happen is the platelets and fibrins will start to deposit. Okay, so the platelets and fibrins will deposit at the endothelial region where there is damage. And what happens when the platelets and fibrins are deposited? Already we have studied in the stages, isn't it? It will result in a clot or a thrombus formation. Okay, so clot or a thrombus formation happens when the platelet and fibrin is usually getting accumulated or deposited on the endothelium. Finally, what happens is this thrombus or clot will become infected. How it is getting infected? Mainly because of the microorganisms. Okay, because of the microorganisms, what happens? There is infection of the thrombus, and that will result in development of vegetation. I might have already shown you the picture. Okay, so that will result in development of vegetation. So always remember, this is the vegetation, and vegetation is nothing but the collection of platelet, fibrin, as well as your what we call as this platelets, fibrins, as well as the thrombus. Okay, that is a clot. All that together is referred as vegetation. Okay, and what will happen further is this vegetation will grow slowly, and because of the gushing or turbulence of the blood, that will release into the circulation. Okay, so if this vegetation is released into the circulation, it is more harmful. Okay, so when the vegetation is released into the bloodstream, it will result in septic embolism or embolization. Okay, this emboli means actually a moving clot like. Okay, so this emboli can dislodge in any organs. Okay, through the blood it can affect your any organs like kidney, brain can be affected, lungs, skin, eyes can be affected, heart and bone also can be affected. Okay, so what happens? Due to etiology, the bacteria is entering through the bloodstream, it will multiply, it will affect the endocardium, it will also affect the heart valve. There is damage to the endothelium, and when why there what happens when there is damage to endothelium? The fibrin and platelet will accumulate. Okay, so that will result in a thrombus formation or a clot formation. Further, what happens is there is infection of the thrombus by the microbe, and finally there is formation of vegetation, that is a combination of fibrin, platelet and the infected thrombus, that is called vegetation. Because of the blood flow, because of the turbulence of blood flow, the vegetation may be released into the bloodstream. That is referred as embolization or emboli formation. So this emboli can dislodge anywhere. The term thrombus means clot, emboli means moving clot. Okay, so it can get dislodged anywhere in the major organs like kidney, brain, lungs, bone, heart, skin and eyes. So what happens in kidney is, when this emboli gets dislodged in the kidney, it may cause hematuria, that is blood in the urine, and it may also result in renal failure. If this emboli gets dislodged in brain, it may result in stroke or cerebrovascular accident. Along with that, person may have neurological symptoms like convulsions, then decreased level of consciousness as well as headache and all. Next is in the lungs. What happens when the emboli is affecting the lungs? Person will have dyspnea, difficulty in breathing, shortness of breath. They may also develop with pneumonia and pulmonary edema. Next is the skin can be affected, like Janeway's lesion, petechiae, splinter hemorrhage. This in detail I will tell you, okay, in clinical manifestation. And eyes, there can be Roth's formation or Roth's eye. That also we will discuss in detail in symptoms. And in the heart, what happens is this emboli can result in heart failure, that is inability of the heart to pump the blood. Heart attack may happen, and along with that murmurs may be heard. Murmurs is a new abnormal heart sound. Why murmur is heard in endocarditis? Because of the excess turbulence of the blood flow. And in the bones you will see oscillar nodes. Sometimes there can be infection of the bone which may cause osteomyelitis, and sometimes it may result in septic arthritis. Okay, these all terms we will see in the symptoms or clinical manifestation. So I was telling about the vegetation, isn't it? That is a platelet, fibrin, as well as a thrombus. That is the figure over here. So here also you can see the normal as well as the abnormal endocardium. So here also you can see the local spread of infection. Next is moving on to the clinical manifestations. So as I told, since it is an infection and inflammation of the heart, most of the time the patient will complain of fever with chills. They may have sweating, body weakness, fatigue, then loss of appetite or anorexia will be there. Because of that, weight loss is very common. Then pallor may be there in the skin. They can also complain of backache or headache, abdominal pain, splenomegaly, that is enlarged spleen. And because of the increased turbulence of blood flow, they can also hear a heart murmur, abdominal discomfort. And because of chronic hypoxemia, there can be clubbing of fingers, which is already mentioned. Okay, clubbing of fingers is already explained. Now, there are some classic clinical manifestations of endocarditis. Classic clinical manifestations means it is only seen in endocarditis. Okay, we'll see what are those symptoms. First of all, splinter hemorrhage. So you can see here in the figure, splinter hemorrhage means black longitudinal streak on the nail bed. That is called splinter hemorrhage. So here also you can see black longitudinal streak on the nail bed. Next one is petechiae. Petechiae are small red or purple spot on the skin. Now this petechiae is commonly seen in the conjunctiva, buccal mucosa, lips, even feet and ankle. Okay, so here you can also see the petechiae in the conjunctiva, isn't it? Small red or purple kind of spots. Next one is Osler's node. Now Osler's node is very painful, tender. Tender means when you're touching you are having pain. They are red or purple, pea-sized lesion on the toes or fingertip. Okay, so that is your oscillar node. Remember, it is painful and tender. When you touch, you have pain. It is red or purple lesion on the toe or fingertip. So here also you can see the figure of the oscillar node. Next one is Janeway's lesion. Okay, so this is also one classic sign of endocarditis. Janeway's lesion, when compared to oscillar node, it is flat. Okay, it is painless. Okay, oscillar's node was painful and tender, but Janeway's lesion is flat, painless and non-tender. It is small red spot on the palm of your hand and even sole of your feet. Okay, so here you can see the figure of Janeway's lesion. So here also you can see the picture. Next one is Roth spot. Now Roth spot means retinal hemorrhage. How you will check for retinal hemorrhage? Most of the time by means of a ophthalmoscope. Okay, so remember Roth spot means retinal hemorrhage. Next is some mnemonics I have given for you to remember the signs and symptoms of bacterial endocarditis from Jane. Okay, F means fever, R Roth spot, O oscillar node, M murmur, J Janeway's lesion, A anemia, nail bed hemorrhage and emboli. Okay, so this is one mnemonic for you to remember. You can prepare your own mnemonics to study for exam. Complication of endocarditis. Now I told already why the complications are seen, mainly because there is thrombus formation. Later it may result in a septic emboli. Okay, and this emboli can get dislodged anywhere in your major organs. Okay, like your spleen, kidney, then your heart or bone, brain. Okay, everything is affected. So complications of endocarditis includes, in the spleen they will see enlargement of spleen, that is called splenomegaly. In the kidney, what happens is patient can have renal failure and hematuria, and sometimes azotemia also. Azotemia means it is elevated urea and other nitrogen compounds in the blood. Okay, and extremities, what happens is because of decreased blood flow, there can be gangrene, that is death of the tissue. And you know, gangrene means you can only do is amputation, isn't it? Next one is what happens in the brain. So emboli, when it gets dislodged in the brain, it will result in neurological symptoms like headache, fainting episodes. Then they can have confusion, or a level of consciousness may be altered. Then sometimes infection can spread to the brain and can cause meningitis or encephalitis. And some patients can also develop stroke or CVA. Now, next is in the heart. What happens in the heart is there can be heart failure. Okay, the heart may not pump the blood adequately. It may cause arrhythmias also. Arrhythmias is nothing but abnormal heart rate and heart rhythm. And because of the excess turbulence of blood, a new heart sound is heard, that is called murmur, which is already discussed long back. Okay, sometimes some patients can go into shock and they can have septic embolism also. Okay, so we have to be prepared to treat the patient. Next is diagnosing endocarditis. First of all, history collection has to be done. You can ask them if they have undergone any recent surgeries or procedures. Thorough physical examination for all the criterias, that is your Janeway's lesion, oscular node, Roth's eye and all. Okay, then blood investigation can be performed and urine analysis can be done. And you can also perform blood culture to see which organism is there. Normally what happens is the person's WBC count, CRP levels and ESR levels will be increased. Some patients may also undergo chest x-ray. Okay, in chest x-ray they will see that person can have enlarged heart, that is called cardiomegaly. Next one is transesophageal echocardiogram. So in this procedure, what they will do is a probe, a small probe with the ultrasound transducer will be inserted into the esophagus of the person, and later they will take the images. Okay, that will be recorded later. That is called as transesophageal echocardiogram. You know what is echocardiogram? Echocardiogram means it is nothing but ultrasound, isn't it? So here you are doing the ultrasound like only, but it is nothing but the ultrasound of your heart. Next is you can perform ECG, electrocardiogram. Sometimes you can also go for cardiac catheterization, which is called as cardiac angiogram or angiography. Next is Duke's criteria. Now, Duke's criteria is told to be positive when two of the criteria is present. Okay, when two criteria are present, we call it as positive Duke criteria. Which are the criteria we'll see now? First of all, a person will have positive blood culture. Next, they may hear a new murmur and vegetation will be seen in echocardiogram. So, if at all in this three, any two are present also, we will tell that a person is having endocarditis. How to manage endocarditis? I told it is nothing but the infection caused by microorganisms. Hence, you have to give most of the time antibiotic prophylaxis. Okay, so before starting with any surgeries or procedure, they will prescribe antibiotics. Okay, example penicillin, gentamicin, vancomycin and all will be given, and these antibiotics are given IV for 4 to 6 weeks. Okay, so you can see the picture of the penicillin and gentamicin here. If it is caused by a fungi, what happens is we need to give antifungals to the patient. Okay, so antifungals will reduce fungal infection like your amphotericin B. Next is analgesics have to be given. Okay, analgesics in order to reduce the pain, commonly indomethacin, aspirin, codeine and fentanyl can be given. Next is to reduce the fever, we can give antipyretics to the patient like paracetamol. Nursing management, now particularly for endocarditis, hospitalization may be essential because you may have to start with the IV antibiotic prophylaxis. Tell the patient to take adequate fluids and to monitor the intake output. They should also have adequate bed rest so that more workload is not there on the heart. Okay. Then IV fluids also can be given unless a person is having heart failure or any other contraindication. Then range of motion exercises, passive exercise can be given to the patient. Along with that, deep breathing exercises are also taught. Okay, and continuously you may have to monitor the levels of the antibiotics. Okay, and see that normally when we give the aminoglycosides or any other antibiotics, it may sometimes be nephrotoxic. Okay, so what you have to do is you have to monitor the RFT, that is the renal function test. Check for urea level, creatinine, blood urea, nitrogen. All these levels have to be monitored. Next is compression stockings can be used by the patient, okay, in order to improve the blood circulation. And you have to always perform blood culture. You can repeat the blood cultures to see whether the organism is present or not. And always see that when you're visiting the dentist, you should always take antibiotic prophylaxis and always have regular dental checkup and a good dental hygiene. If necessary, the patient should be given with oxygen. Monitor the arterial blood gas and oxygen saturation, and try to give small and frequent diet to the patient and provide good nutrition and good hydration to the patient. Okay. So the nurse's responsibility includes monitoring the vital signs, assessing or listening to the heart sounds if there is any abnormal heart sound, and signs and symptoms of embolization. Okay, and also monitor for complications and see the IV lines whether there is swelling, redness. If there is swelling and redness, what you have to do is IV catheters or IV lines have to be removed immediately and you have to put it in a new vein. Okay. Then next is you have to give the medications on time, provide family support or emotional support to the patient. Okay, so those are the basic things that you need to do. And next is nursing diagnosis. You know what you have to write in nursing diagnosis. Assessment, that is assess the pain, assess for tenderness, okay, or assess for complications and monitor for complications. Next is nursing diagnosis. Hyperthermia related to infection of the cardiac tissue. For that, what you have to do, monitor the temperature, give cold compress. You can give antipyretics to the patient, switch on the fan and improve the ventilation. Next nursing diagnosis is decreased cardiac output related to valvular insufficiency. In that case, you have to auscultate heart sound, heart rate, see for the new murmurs, also check the capillary refill, see the skin color, temperature of the patient. Okay, see for any jugular vein distension, provide with diuretics if necessary, monitor the BP of the patient and provide oxygen therapy. Third nursing diagnosis is activity intolerance related to weakness. What we can do for activity intolerance, we have to monitor the vital signs, keep the articles at the bedside of the patient, okay, encourage the family members to assess the patient. Okay, so this is particularly regarding endocarditis and most of the time it can be asked for 10 marks.